I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More Here.
Welcome to this episode of IDD Health Matters. Our guests today are Bethany Toledo and Becky Watson with the Ohio Alliance of Direct Support Professionals. Welcome. I'm going to start with you, Bethany. Tell us about the organization.
Sure. So, as you said, we're with the Ohio Alliance of Direct Support Professionals, and our mission is to educate, elevate, and empower direct support professionals and other frontline professionals in the field of IDD.
So, for people who might not know what a direct support professional is, and most likely most of our audience does, what are some of the responsibilities that a direct support professional has?
Oh, goodness. Well, just think about your daily life. In anything that you do in your life, whether you get up in the morning, go to work, you have doctor's appointments, a DSP helps with all of those things. They support a person, in whatever manner they need to be supported.
So it sounds like a lot of responsibility.
Oh, yeah. It's a broad scope of practice.
So is there kind of a particular training that's involved or credentials that people should look for if they want to become a direct support professional?
So that's actually how OADSP, came to be. Back in the late 90s, early 2000s, there were some studies coming out of the University of Minnesota saying, you know what, there's a workforce crisis coming. Baby boomers will retire one day. And so a group of people got together in Ohio and said, how are we going to address this? And so they created a credentialed career path. So we actually have a credentialing program for direct support professionals, and that's called the DSPAS credentialing program. And then we also have a frontline supervisor credentialing program.
That sounds excellent. So Becky, can you tell us a little bit more about the credentialing process or the pathway?
Yeah, so we have a basic certificate that people can do. We also have a certificate of initial proficiency. We have a certificate of advanced proficiency. And then we have the frontline supervisor curriculum that we can do. And then we also have a program that I primarily work with that's called DSP University. And that's a pathway that we have that we go into high schools where seniors can take this, and they take it. It's the certificate of initial proficiency, and they take that during their senior year, and it's 20 modules that are 3 hours long, so it's 60 hours of education. And then they also do an internship component with that. That's about 100 hours on average. And then they also, after the internship component, they do 15 badges, and that is through the National Academy of Direct Support Professionals. So by the time they finish, they earn points towards their high school diploma with this program. And then they also earn, through the Ohio Department of Education, a credentialing that is a state credential, their CIP credential, and then they also earn a national credential.
All right. You said high school, right?
Correct. High school.
That's pretty neat. When we think about how we end up working in a particular field, a lot of times it's what we're exposed to, what we're aware of in our early years. I mean, I grew up in a very small town. I didn't see a lot of career opportunities except for what I saw around me. And one of those was the physician that we went to. And I was like, oh, this seems pretty neat. And I like science, and that's kind of how it ended up here. So that exposure in the high school time period really opens up, I think, that as an opportunity for people to see this as a career path.
Absolutely. I know for myself, it wasn't until I was in college and I actually started in the education field. And I had an experience with someone with a disability. I had no idea the vastness of the field, that awaited me. And here I am 32 years later, not in education and in the field of disabilities.
That's another thing that I see happen a lot. We kind of, you either fall into this field, kind of like I did, and it sounds like you kind of did a little, or we have a family member who has a disability, and we learn about the field that way. But once you get into it, you realize pretty quickly that this is either not for me, or it is for me, and you're stuck here forever.
Yes.
So that sounds like our story. So Bethany, so you're credentialing people in high school, basically. They get high school credit. And what other types of training or opportunities do you see as important or valuable if you want a career in this field?
Yeah. So another big focus that we have is leadership development. And we have programs that are for leaders of all levels, regardless of your title, your position within an organization, because anyone can be a leader. And some of our leadership programs focus on advocacy, so helping people even advocate for themselves and higher wages for direct support professionals. So most recently, we supported some direct support professionals to give testimony at our state house. And, that testimony really had a large impact. We're looking at a historical investment in direct support professionals, in Ohio, and this is historical. So we're proud to be a part of that. We also kind of see ourselves as a social support for DSPs outside of the organization that they work for. We recently partnered with the Ohio Department of Developmental Disabilities on a project called the DSP Experience. So we traveled around the state and we met with direct support professionals and we learned directly from them what their experiences have been, what their struggles are, what is it that they need in order to be successful as DSPs.
I like that support aspect that your organization has as well too. And from my perspective, you would think, well, I had a lot of support in this field, but I didn't. As a physician who worked in this field, I knew no one else when I was early on in my career doing this, and some of the nurses that I worked with who also worked in this field, they knew no one else. And it's really nice to have an organization to help, for lack of a better word, support you through some of these things, to learn from, to share, to commiserate with, and share some of the challenges. But just know that you're not alone. Yeah. So there's
absolutely.
a lot of value in that. That's excellent. So you talked about leadership and leadership development. Is there more to talk about that?
Yeah, sure. So we have a program called Leadership Launchpad, and that is a 3-day leadership retreat for leaders of all levels. And during that program, the only title that our participants have is leader. So we have direct support professionals, frontline supervisors, CEOs. I've had some of my own board members go through the program. And actually, I'm going to pass this over to Becky because Becky actually attended Launchpad when she was a board member for OADSP.
I sure did. And I grew a lot in that time frame, more than I even anticipated that I would. Not that I didn't think, Bethany likes to call them nuggets. Not that I didn't think I would get some nuggets and take away, but I had huge aha moments during that time. I actually recognized a place where I was in my career that I didn't even really knew I was, if you will, from that experience. So it was a huge learning for me, and a catalyst to actually do what I'm doing right now, sitting in this chair. It was a change and pivotal in my career.
So this sounds really exciting and really innovative that the state of Ohio is doing in terms of, and your organization is doing in terms of supporting people with who are interested in becoming a direct support professional and having that career path. Do you know of other states that are doing these types of things?
I'm going to let Bethany speak to that because she actually leads us in that, and we are doing things outside of Ohio, and we have some potential to do more.
Great.
Yeah, so we do some consulting outside of Ohio, that helps fuel our economic engine. And so there's a lot of interest in creating support networks for DSPs that are specific to the states.
Yeah, well, one of the purposes of what I'm doing is to help people see this field as a viable career opportunity. Mm-hmm. And I think that's why when I talked to you initially, I was like, oh, you've got to be on the show because you have a wonderful pathway to help people learn about this field and see it as a career path. And sometimes this career path, like so many things we do, or launch us into other things. I've talked to so many guests that started off as a direct support professional and are now organizational leaders, executive directors of organizations, or even state agencies. So it's pretty interesting what this field has to offer.
Yeah. And when we talk about our high school program, we tell students and we tell schools that regardless of the career that someone chooses, just knowing how to support people in their community in any capacity is beneficial and, will last them a lifetime.
So since this is IDD Health Matters, I always like to talk a little bit about health. And I know that direct support professionals have a tremendous responsibility in helping ensure that a person that they support stays healthy. And part of that is being able to recognize signs of early health destabilization in people that you support. Do you have training that focuses on that at all in the program?
Yeah, so when people go through our credentialing program, there are areas of concentration that they can work with, and a lot of times people select to like help someone with an area of their health, and then there's some general things, just, overview. I don't know, Becky, if you want to clarify a little bit.
Yeah, there are. And there's also, like even with they earn their badges in the DSPU program, there's some self-care, and it's like, how do I care for myself so that I'm healthy and I can then provide care that I need and recognize that care is needed in the people I support as well. So it's also about the people they support in staying healthy and themselves staying healthy.
Yeah, and that's definitely an important part of this, I think, too, a very valuable part of it, because if we're not healthy, we're not going to be able to do a good job no matter what we're doing.
Correct.
So paying attention to that as an organization is great as well, too. Yeah.
Yeah.
Good stuff.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So one of the things I like to do on the show is I like to ask people to tell us 3 things in 3 minutes that they would like people out there to know about that can improve the world of supports and services, or just 3 tips or words of wisdom that you would have for people out there that maybe are considering this as a possible career path. So you can do the 3 between the 2 of you, or you can do 3 each. I'll give you the option.
All right, let's do the 3 between the 2 of us.
I know.
Yeah. So if you are considering a career as a direct support professional or just interested in exploring the field at all, I would say that, don't let fear stop you. A lot of us started our career as direct support professionals. I started as a DSP when I was 19 years old. Becky started as well, I believe, in college.
19.
Yeah. And my best advice to you is to be a pain in the ass. Ask the questions. There are no dumb questions, no silly questions. You don't know if you don't ask.
I guess my tip would be to know that it is a great foundation, being a DSP, no matter the career you want to go in. If it's healthcare, if it's education, if it's a business, no matter what it is, you can't go wrong with being a DSP is the foundation to put you into that career. At some point, you're going to work or support someone with a disability, and having the foundation and the experience, the education of being a DSP will not steer you wrong in any way.
Oh goodness, so does that mean I get the 3rd one?
I tell you what, I can save you on the 3rd one.
Okay.
Here's the 3rd tip. If you want to learn more about what this organization is doing in Ohio, or if you have an interest in expanding this to your state or your area, how can they find out more about what you do?
Sure. So you can visit our website, which is oadsp.org. And there are a lot of beneficial resources on there. Actually, our DSP experience report that we mentioned earlier, that's available there. And we have a great platform called OADSP TV Plus, and you can just learn all kinds of things.
Wonderful. Yep. Go ahead.
Sorry, I just want to say that OADSP TV Plus is free. So all of those resources are at no cost to you. And there's a lot on there. There's fun things you can do with the individuals you support, and you can access that as much as you want with no cost.
Thank you so much both for being on the program, and more importantly for the incredible work that you're doing in this field. Keep it up. Best to you all.
All right. Thank you for having us.